Hi, my name is Nazmul Haider. I am a postdoctoral researcher at Royal Veterinary College. We are working in a consortium called Pandora IDNet, and we are primarily working in sub-Saharan African countries. Today, I will be discussing on our new research on global case fatality rate of COVID-19 that has been declining disproportionately between top 20 vaccinated countries in the world and rest of the world. So this research is the continuation of a series of publications on COVID-19 that we have been doing in last 1.5 years, especially on sub-Saharan African countries. So let's start with some background. We know vaccines aid in a reduction of case fatality rate of COVID-19. Globally, COVID-19 vaccination rollout is progressing at various rates. For example, on 31st August 2020, almost 40% of the global adult population received at least one dose of COVID-19 vaccine. In top 20 countries with higher COVID-19 vaccination rate, 144 doses of COVID-19 vaccine was given to 100 people. For the same number of people in the rest of the world, only 62.3 doses of COVID-19 vaccine was given. So this is an earlier publication by our group that shows that global case fatality rate of COVID-19 has been declining since May 2020 after it reached its peak on 17th week, which is the end of April 2020 at 7.23. Then it started to decline up until 53rd week of December 2020 at 2.2, and this declining trend of COVID-19 case fatality rate is explained by an increased rate of infection in the younger population, the improvement of healthcare management, the shielding of older population from the infection, and repurposing of several drugs, including dexamethasone. During the last quarter of the year 2020, a number of variants of concern started to emerge in different parts of the world, including alpha, beta, gamma, and delta. The delta variant is one of the most important viruses because it has almost twice as transmissibility than the original virus detected in Wuhan, China. And this new variant of concern started to cause new waves in different parts of the world, including in India, the rest of the Asia, Europe, North America, also in Australia. In June 2021, 99% of the sequenced and genotyped cases in the UK were recorded as Delta variant. The objective of this study was to compare the global cumulative case fatality rate between top 20 countries with COVID-19 vaccination and rest of the world before and after commencement of vaccination program, and also to quantify the impact of vaccination and other control measures like lockdown measures on the case fatality rate of COVID-19. So the methods, we collected global data on COVID-19 cases, death and test data from WHO's, and other record, including vaccination and other country-specific variables like stringency index were collected from our world in data. We considered the 28th day of receiving the first vaccine in the world as the cutoff value to compare the pre-vaccination period and the post-vaccination period. We performed generalized linear mixed model to investigate the association between the case fatality rate and the potential predictor of each country's and reported the coefficient or relative risk. We performed a time series model including ARIMA or PROPET for forecasting the case fatality rate of COVID-19 using global data and data of top 20 countries with vaccination and rest of the world. So the result, this is the list of the countries with the higher vaccination rate, and you can see that most of the countries are recorded from Europe and also from Asia, some countries from South America and North America, but there is no country from Africa or Oceania. The case fatality rate of COVID-19 in countries with different vaccination status. On 5th January, the case fatality rate in top 20 countries with higher vaccination rate was 3.6. On 31st August 2021, the case fatality rate in those countries is just 1.6, dropped by 2%. In the rest of the world, the case fatality rate was 3.2 on 5th January 2021. And 8 months later, that value is now 2.3, dropped by nearly 1%. So this is the time series forecasting model using ARIMA and Prophet model. And you can see that in general, both model predicted a declining trend of case fatality rate of COVID-19. And you can see a moderate R-square value between observed case fatality rate for the period from January to August 2021 and the predicted case fatality rate for the same period. So this is the result of generalized linear mixed model. You can see the model in the right hand side. The relative risk of vaccination was 0.03, which is less than 1. That is, it is a protective factor. Stringency is also a protective factor. On the other hand, obesity increased the risk of case fatality rate. So we found that the stringency index, which is a combination of different lockdown measures, is significant, but it has a lower coefficient than the vaccination. So we need to be careful in interpreting this data. The COVID-19 cases and death data that we recorded from WHO is actually came from different countries of the world, and they have the countries have different capabilities, different willingness, and they use different strategies to test COVID-19. And some countries use different case definition for confirmed and death, confirmed cases and death. Thus, we believe this case fatality is not the true case fatality rate, and thus we propose to consider this case fatality rate as a reported case fatality rate. Then impact of vaccination could not be separated from the impact of lockdown related control measures, but we found that vaccination has 4 times stronger risks than the stringency index. So that is, in crude sense, vaccination is 4 times more effective than the control measures. So in conclusion, despite the emergence of different SARS coronavirus 2 variant of concern, the case fatality rate continues to decline, but it is declining at a disproportionate rate between top vaccinated countries and the rest of the world. In the top 20 vaccinated countries, the rate has dropped by 2%. In the rest of the world, it has dropped by 0.9%. And we believe vaccine equity and faster rollout across the world is critically important in reducing COVID-19 transmission and case fatality rate. And in the final slide, I would like to acknowledge EDCTP for funding this research and Pandora IDNet for working in sub-Saharan African countries. And I would also like to acknowledge my other co-authors from different parts of the world. And finally, thanks a lot for your patient hearing, and I'll be happy to respond to your queries.